So without wasting much time, let us start the meeting with a prayer. Lakshmi Nandakumar will be reciting the prayer. Over to Lakshmi, please.
Yeah, thank you. Audible, alle, Chichi?
Yeah.
Okay. Vande Mataram Subhadam Shubhadam Malayaja Shitala Sasya Shamala Mataram Vande Mataram Shubhra Jyotsna Pulakitayamini Pulakusumita Drumatala Shogini Subhasini Madhura Bhashini Sukhadam Varadam Mataram Vande Mataram Vande Mataram.
Can I now request our President Usha Rajagopal to welcome everyone and our chief guest speaker, Dr. Premachandran. Thank you. Usha, you are muted.
Namaskaram. A very warm welcome to all my dear friends who have joined this webinar. We were not able to meet for quite a long time because of the present pandemic conditions. Now we hope we can meet more frequently and share our thoughts and listen to some educative and informative talks by eminent persons. On behalf of Suvarna, I extend a very warm welcome to all those who have joined us from Kerala and also outside Kerala. A very special welcome to our zonal organizer, Usha Nair. Today's program is on bone changes in the elderly people. As we grow old, most of us do suffer from backache, pain in the neck, pain in the shoulder, knees, etc. This will interfere with our daily routine work to variable extent. Today, we have with us an eminent orthopedic surgeon, Dr. K. Premachandran, to talk to us on the subject of bone changes in the elderly, with special emphasis on problems in elderly women. A very warm welcome to you, Dr. Premachandran. Professor K. Premachandran passed his MBBS from Calicut Medical College in 1967 and joined his alma mater as tutor in orthopedics. He did his master's degree in orthopedics from Delhi University in 1974 and passed the prestigious MCH examination from the University of Liverpool in 1985. He has worked in the medical colleges of Trivandrum, Alleppey, and Kozhikode. He did his higher training in orthopedics in UK in the National Health Scheme for 6 years and worked as a senior consultant in the Ministry of Health, Sultanate of Oman for over a decade. He worked as professor of orthopedics in Amrita Institute of Medical Sciences, Kochi for 5 years. Presently, he is working as a senior consultant and head of the Department of Orthopedics in PVS Hospital, Kozhikode. His association with the AWC is that he is our active member, Kalyani's husband. Now, I invite Dr. K. Premachandran to talk to us. After the talk, we can have an interactive session also. Now, over to Dr. Premachandran.
Thank you, Usha. I must thank the president of the Calicut unit of the All India Women's Congress or Conference, Mrs. Usha Rajagopal, and Secretary Mrs. Bhuvaneshwari Ravindran for having invited me to give this talk to you, to this august audience from across the country. Now, this topic, that is the skeletal changes in the elderly, is of paramount importance to all of you, irrespective of our race or gender. But the question asked is, are women at increased risk? Before proceeding, I should give the answer, yes, women are at increased risk. And that's what precisely we are going to look at, why women are at increased risk in osteoporosis. Now, the learning objectives of this lecture will be to understand the changes that occur in the bone, which we commonly refer to loosely as osteoporosis. In the literal term, it means just porosity of the bone, or it's essentially a weak bone. We'll also look at the changes that occur in the skeletal muscles along with aging, and what these changes or what impact these changes produced on our body and our lifestyle. A brief look at the clinical scenario, how it presents and how it is diagnosed, will also be discussed, but only briefly. But I will be emphasizing mostly on the prevention or control of osteoporosis, how to manage it successfully from the medical point of view as well as from the point of view of the layperson. Now, what is osteoporosis? A lot of confusion has occurred in the minds of the laymen about the definition of osteoporosis. Just now, in the introduction, Mrs. Usha Rajagopal said all of us experiencing back pain or neck pain during our aging, and this is troublesome. But that is not osteoporosis. That is essentially a degenerative process occurring in your joints of your spine, peripheral joints in the limbs. That is entirely different. That is osteoarthritis. Osteoporosis is essentially a painless condition. That's what we have to understand first. It is just a painless condition. It can be called a silent thief who robs your bones. But it becomes painful when it is associated with a fracture that can occur. And another myth in the minds of people is that osteoporosis means just a deficiency of calcium or vitamin D. It is not so. Vitamin D deficiency and calcium do play a part in osteoporosis, but the WHO definition of osteoporosis is that it is a condition where there is a reduction in the bone mass and mineral density with deterioration of its microarchitecture. This part I have underlined because that is one of the most important factors in the production of the sequelae of osteoporosis. That is a deterioration of its microarchitecture. So when there is a reduction in the bone mass with deterioration of the microarchitecture, that produces a reduction in the strength of the bone, leading to its becoming fragile. And when it's a fragile bone, it leads to fragility fractures. The term fragility fractures has been coined by WHO, the definition of which I will come to a little later, but definitely it produces fractures. That's what we are worried about now. Now, coming to the microarchitecture of bone, just briefly, this is what a normal bone looks like under the microscope. The top portion you can see, I don't have a pointer, yeah, okay. That is a bone scaffold. You can see the bony spicules or scaffold that is called. In between there are spaces, and these are pretty strong bony trabeculae, which we call in medical terms called trabeculae. It gives a sort of a spongy appearance. It's a spongy sort of appearance there. And under the electron microscope, which is magnified here, you can see this very strong bony trabeculae with a very small spaces in between. So these spaces represent the canaliculi of the Haversian canal systems, which are in the bone, which I will not go into the detail of that. But consider this bony microarchitecture with that of an osteoporotic bone, you can see that the bony trabeculae have become very much thinned out with large spaces between the sparse trabeculae. And under the electron microscope magnification, you can see the large spaces with very diminished or attenuated trabeculae, and some are even broken. So this is the essential pathology that occurs in osteoporosis. This is what happens to your bone. And about osteoporosis, it is a global epidemic. It is not concerned with just for us in India or USA. It is concerned with the human race. Now, when you say global pandemic, immediately people think of coronavirus now. But much before that, it existed ever since the human race had existence in this planet. At a time, there are over 200 million cases in the world over, but this is a very, very conservative estimate. There is no accurate, there is no mechanism by which you can get an accurate figure all across the globe. Mainly, we are depending on the statistics from Europe or USA, and projected it comes to over 200 million cases, which I am sure it will be more. There is no racial bias here. Every single race is affected. There is no gender bias in the sense that more males are equally as affected as females, but the proportion differs, that's all. And it is more common in the Caucasian race, that's a white race, compared to the black race. It is common in the elderly for obvious reasons, and it is common in women. So there is no gender equality here. Women are more affected. Now, at a given time, we said there are about 200 million cases. Just look at this graph. It's a little, sorry, it is a little confusing, but just concentrate on the dark green bar and the light green bar. This is the incidence of osteoporosis among the US population in the year 2017 to 18. And whereas there was a 8.4% male incidence, the female incidence, the total incidence is shown here. The men in the 50 to 64 age group, there were 3.3% males, but the women were 13.1%. This is the 50 to 64 age group. When it comes to the 65 and over group, males were only 5.7% of the osteoporotic population, whereas women were 4 times over, 27.1% of females were osteoporotic. This is the US figure which I got in 2017 to 18. So it's a global pandemic. And before we proceed, we have to briefly mention a process called bone remodeling, which occurs in our bones all throughout our life. It is a dynamic process which happens day in and day out, by which old bone is removed and new bone is generated. This occurs due to 2 processes. One is called bone resorption or bone lysis, produced by bone cells called osteoclasts. And there is a simultaneous process called bone formation, which is done by another group of cells called osteoblasts. Now, this process, these 2 processes should go hand in hand, and they are dynamic in nature. And normal bone balance depends on a total balance between formation and resorption. So unless that is maintained, you cannot maintain the proper health of the bone. Now, this again is another bone model actually. So you can see the bone here, and these are the cells, bone cells in the resting stage under the influence of certain hormones, notably parathyroid hormone, growth hormone, etc., and under the effect of certain conditions in the blood, like level of calcium. These bone cells become activated to become what is called the osteoclasts, which are bone resorbing cells. They, in a sense, they just gnaw at the bone and destroy the bone. In the process, what they do is they liberate calcium from the bone into the bloodstream. So when the blood level of calcium is low due to whatever reason it is, under the effect of the parathyroid hormone, which is destined to maintain the correct calcium balance in the body, it stimulates these cells to become osteoclast and it undergoes bone resorption. The bone undergoes resorption. This occurs even without any disease. It occurs in the normal bone also. Now, once that resorption has occurred, there is a resting phase. And then after some time, the cells become osteoblasts. A new kind of cells arrive at the scene called osteoblasts, which produces new bone and remodel the bone, which is a much more prolonged process. It takes about 3 to 4 months for this part of the process to be completed, whereas resorption occurs much faster. So when you have a bone formation and bone resorption at equal balance, you have normal homeostasis. But when bone resorption becomes more, when it overpowers the bone formation, then you develop problems like osteoporosis. Now we have to have a close look at this particular graph, which is very important. It talks about the generation of bone mass, how we produce our bone mass. This pink is related to the female and the blue relates to the male. So ever since birth, during the childhood or infancy and early childhood, as we grow, we are improving our bone mass. We are creating bone mass. And this keeps on improving till you reach what is called the peak bone mass around your age of 30 or so. In the male, again, it goes at a higher rate than in the female because of the size of the male is more than the female, or the stature generally speaking. So they are getting a higher peak bone mass around the same time. That's about 30 years of age. Now, in the female, this remains, this peak bone mass is maintained till the age of 40, slight fall around 50, and then as menopause occurs, there is a precipitous fall in the bone mass. And then after menopause, at the age of 60, the bone loss becomes much more gradual till it continues like that. In the case of male, just look at that. This peak bone mass is maintained for a slightly longer time. And the decline in bone mass is very, very gradual compared to the female. So that is why the effects of osteoporosis are always more on the female. This graph also tells you one thing, that the maximum bone mass occurs between the age of 20 to say 40 years or 45 years. That is the time when you are very active, when your sex hormones are at their peak, exercising their anabolic effect, whether it is the testosterone or androgens in the male or estrogen in the female. This is a peak bone mass period because they help. Because of their anabolic effect, they're producing the peak bone mass at this level. And this decline, you can say, occurs at a time when there is a gradual decline in the level of your sex hormones. That doesn't mean that only sex hormones are responsible for bone mass. They are one of the most critical factors that is responsible for changes that occur in the bone mass. So this is very important. It also tells you that the higher the bone mass, the less will be the loss. So it is very imperative that at your young age, you try to gain as much peak bone mass as possible. That is your fixed deposit for the future years. Now, this graph just shows that between 10 and say about 30, there is an active growth of bone mass. Then around 35, you just start a slow loss. And around menopause or perimenopausal area, get a rapid loss, and then a less rapid loss with the succeeding years. That's all it shows. And around that time is when you develop this stupor or the hunchback. Now, what are the factors influencing bone turnover? Age is number one factor because old age produces a slowdown of all metabolic processes, including bone formation, whereas bone resorption may continue because of age. And naturally, your level of activity is also much less during old age, so that also contributes to the increased turnover of bone. Gender, as we have said, how it affects females more. Activity. One of the biggest stimulus for bone formation is activity. If you lie in bed, if you are bedridden for a period of, say, let's say, for a period like 1 month or 2 months, for whatever reason, some disease or fracture or anything, you develop osteoporosis because that is a reaction of the body. You don't require strong bones when you are lying in bed. So all the calcium is mobilized from the blood because that's a waste lying there. So it is removed. So on the other hand, when you're active, the bone needs to be strong. So body realizes that and it stimulates bone formation. That is how exercise becomes beneficial in osteoporosis. So again, your nutritional status is very important. Unless you have a balanced diet with proteins, minerals, vitamins, everything thrown in, you will develop osteoporosis. There are factors that influence bone turnover. Then there are hormonal factors, as we have seen. Mostly responsible hormones are growth hormone, especially during the growth period, that is the time when you gain your height and your stature. That's the action of the bone growth hormone, which increases the length of the bone as well as the girth of the bone. Sex hormones, we have seen how they act on the peak bone mass. A parathyroid hormone, it's a hormone secreted by the parathyroid glands on the four corners of your thyroid gland, are responsible for maintaining calcium balance in the body. So it is a very potent resorption, bone resorptor. And when there is a slightest level drop in the calcium level in the blood, it will stimulate the bone cells to become osteoclast and start bone resorption. So they are the hormonal factors that are responsible for this osteoporosis. Then, of course, certain drugs, we all know that steroids, which are used over a long period of time for diseases like rheumatoid arthritis and other collagen diseases, they can develop osteoporosis. And there are so many other drugs also. I'll not go into the details of that, but they can produce osteoporosis. Now, we have seen that incidence worldwide is around 200 million cases. Now, of the osteoporotic population, 1 in 3 women become osteoporotic, whereas 1 in 8 men only have osteoporosis. It affects 75 million persons in the US, Europe, and Japan. Unfortunately, we don't have such a good sort of data in our country, so we don't know what is exact incidence in India. But the worrying factor is that this condition is responsible for over 1.3 million fractures each year. Now, when you say there are 1.3 million fractures each year, you have to think about the financial burden, not only on the family, but on the healthcare systems of that particular state or country, and the morbidity that associated with the fracture. So this is why this condition assumes importance. Now, it may not be a very happy statement when I make it that 80% of those suffering from osteoporosis are women. That is the answer to the first question. Is it relevant to females? Yes. So that's about 80%. It is a large percentage of osteoporotic population are women. Now we have to look at the female sex hormone, the estrogen, which is also called the glow hormone by some people, because it is associated with the glow that is seen on the face of pregnant women, especially towards the later stage of pregnancy. This is not only due to estrogen, partly it is true, but it is also due to the increased production of sebum, that is the oil from the sebaceous glands on the face, which gives it a sort of shiny look, and that is what is or the glow of pregnancy or whatnot. But definitely, estrogen is responsible for the younger looking skin that you all have in your younger age. Younger looking skin, soft skin, mainly due to the abundance of subcutaneous fat. There are no wrinkles or creases because it is supported by the fat underneath. And is also responsible for the increased fat deposition, the feminine type of fat deposition in the right places, and is also responsible for the higher metabolic and energy levels. Estrogen produces a high metabolic turnover and energy levels, and it has a cardioprotective effect in the young female. Very seldom do you hear a 35-year-old or 30-year-old female or 40-year-old female even dying of a heart attack, whereas at that age, a lot of males die of heart attack these days. So there is a cardioprotective effect for estrogen at that age group, which you lose after menopause, and you become as vulnerable as men. Now, the effect on bone is that it decreases bone resorption. Estrogen is an anabolic hormone. That's very important. So it improves it decreases bone resorption and maintains a healthy balance. And it has a positive effect of bone formation. And it also helps to increase the muscle mass when the estrogen level is active. Now, this hormone, if you look at the monthly cycle of a female, there is an interplay of hormones, which is very fascinating actually. The interplay of hormones between the ovary and the pituitary, how they balance each other. There are 4 main hormones here, but 2 are ovarian hormones. Let us concentrate on them only. This red line is estrogen, which starts peaking around the 7th day of the cycle and reaches a peak around the periovulatory phase. And then once ovulation has occurred, rapidly comes down and again rises towards the 3rd week and then falls down and touches normal. Unless a pregnancy ensues there, then it will rise again towards the 3rd trimester of pregnancy. The highest levels of estrogen are found towards the terminal months of pregnancy, that is the 3rd trimester of pregnancy. The other hormone, which is the progesterone, that is a dotted line just below that, is called the pregnancy hormone. It's progesterone. Again, it is an anabolic effect on the bone, but that peaks only very late and it rises around the 3rd week. And then again in pregnancy, it peaks again like estrogen towards the 3rd trimester of pregnancy. And these are all controlled by the pituitary and the luteinizing hormone and the follicle. All these stimulating hormones it's a very fascinating interplay. I will not go into the details of that. And if you look at the estrogen level in a female, it rises maximum from the age of menarche, and by the time you are about 35, practically swimming in the estrogen there. And then coming down, it gradually drops down, and towards the menopausal age, it drastically comes down. And by the time you're 70 or 80, it is down in the boots. So that is your hormonal level. So this is the menopause area. So there is this is the curve you can have for your estrogen level. I'm sure you will all remember this 18-year-old who in 1955 or so acted in her debut Bollywood movie. And no doubt she has maintained her poise and charm even now and has aged very gracefully. Just put this picture just to show you what estrogen can do to your appearance and what slack can do to your appearance. So this is what estrogen does to a female besides the bone. Anyway. Now, the aggravating factors for osteoporosis are early menopause. Some women attain menopause at a much earlier age, much earlier than the normal. It can also occur due to some surgical procedures where you have to remove your ovary or something like that. Some disease conditions also can cause early menopause. So when you attain early menopause, your chances of developing osteoporosis is a little earlier, and the course is also much more dramatic. Decreased activity levels, which occurs mainly during aging and also due to behavioral pattern. Some people tend to become sedentary after a certain age or even before a certain age, and they will have an aggravation of these factors. Poor nutrition for whatever cause can be an aggravating factor. Also lack of exercise, sedentary lifestyle, which I mentioned, and associated illness. By this I mean illness related to, say, chronic liver disease or chronic kidney diseases. These can affect the metabolism of vitamin D, because the vitamin that you get from sunshine is metabolized first in the liver. It has to undergo a hydroxylation process in the liver, and then it has to have another hydroxylation process in the kidney to become the active form of active metabolite of vitamin D. And if you have a kidney disease or a liver disease, these processes can get compromised. So you can develop osteoporosis, and it affects, vitamin D is very essential for calcium metabolism, in the sense it is essential for the absorption of calcium from the gut. It's essential for the mineralization process to occur in the bone. So they act in tandem. This calcium and vitamin D are practically inseparable friends. So associated illness also can be an aggravating factor, and certain medications also, like steroids, as we have said, and some anticonvulsant drugs which are used for epilepsy. This can also produce an aggravating effect on the incidence of osteoporosis. How does it present? As I said, it's a very silent thief. You don't know when you have got osteoporosis. It just comes in silently, robs you of your bone stock, and you know about it only when you go to your doctor for some symptoms like, say, a backache due to no reason, or maybe a trivial injury, or what you call a catch in the back or a slide fall or something, and the doctor takes an X-ray and you see something like this, where the one vertebra is crushed. Apart from the crushing of that vertebra, you also find that the density of the vertebral blocks in the X-ray is also much less, and it is this is what is called a crushed or a wedged vertebra, which is due to the pressure of weight on the vertebra, and sudden flexion force can cause this because the vertebrae are weak. This can affect not only one, sometimes you will see many vertebrae affected like this, another like so, or it can be as bad as this, where many vertebrae are affected, and this is a picture of a stoop due to vertebral collapse. So this picture will tell you that this person definitely has osteoporosis, unless you can explain. Such a picture you will not see in a younger individuals. You will see an isolated fracture if that person falls from a height or something, but this sort of a picture is very typical of osteoporosis or certain diseases which can produce osteoporosis. So that is secondary osteoporosis. So this is one way of your presenting osteoporosis. You can also present with fragility fractures, like this definition of fragility fractures is fractures that occur due to fall from a standing height or less. Now I am sitting on a chair. Now if I fall from this chair or a stool and I get a fracture of the wrist, that definitely means I am osteoporotic. It is a fragility fracture, because you are not supposed to get a fracture with a healthy bone from that kind of a fall. So the WHO definition says that any fracture resulting from fall from a standing height or less can be a fragility fracture. Sometimes instead of the vertebral fracture, patient will come with this, a fracture of the wrist, or more commonly a fracture of the neck of the femur or the hip, or a fracture around the shoulder. The upper end of humerus is fractured here. Now these are all fractures which are commonly seen. But the problem is not just the fracture, because these are all occurring in elderly people. You cannot treat them conservatively in a plaster or in a sling, because the more you keep them in bed or immobile, their osteoporosis is going to be aggravated. So we have to get them back on their feet to their pre-injury level of activity. For that, only surgery can help. So all these fractures will need surgical management, and this again, as I said, will be a terrible burden financially on the family as well as the health systems, and it results in a certain amount of morbidity also. So this is what we should try to avoid at all costs. Now, what is the risk of subsequent fractures? If you have a fragility fracture, a vertebral fracture, or a fracture of the wrist, what are your chances of getting subsequent fractures? I'm sure after this slide is completed, you will call me the prophet of doom, because 21 to 32% of women with 1 or 2 fragility fractures will experience a major osteoporotic fracture within 5 years. This is one statement from a particular study. Another statement says, women with 1 or more prior fractures are at increased relative risk of subsequent fracture within 24 months. Still worse, vertebral fractures were associated with a 2.5 to 4.1% increase in risk of major osteoporotic fracture within 24 months. Now, this applies not only to female, but to a certain extent to males also who are suffering from osteoporosis. So once you have an osteoporotic fracture, that is a warning given to you to take it very seriously and to prevent further deterioration, because you have a very high chance of developing a subsequent fracture. That is also to be noted. Confirmation of diagnosis, as I said, clinically, when a patient presents with a fragility fracture and the X-ray shows a decreased bone density, you can immediately make out that it is osteoporosis. But for documentation purposes and also for treatment purposes, we confirm the diagnosis, what is called a DEXA scan, which is a dual energy X-ray absorptiometry. That is a full form of this scan, DEXA scan. Now here, you are just lying on a bed like you lie on an X-ray table, and an X-ray beam is, low energy X-ray beam is moving over your body from the lumbar spine down to your hips. And what it does is, it is analyzing your mineral content in your lower lumbar spine and also in your hip area. Now after this, you will get a report which mentions 2 values, a T-score and a Z-score. Now, we are concerned more about the T-score because that is a comparison of your bone density with the bone density expected for a young, healthy adult of your gender and ethnicity. You cannot compare your bone density with that of an American or a African lady. You have to compare it with the bone density of a young, healthy adult of your gender. That's female to female or male to male, and of the same ethnicity. So that difference is calculated, and it is expressed as a standard deviation score, ST score, which is called the T-score. In addition to that, the difference between your density measurement and that of someone of your age is expressed as standard deviation Z-score. So you are comparing your density with a comparable age and of course ethnicity, whereas T-score compares your bone density with that of a healthy young adult. Now we are concerned more about T-score. Now WHO has classified T-score as, if your T-score is above -1 standard deviation, then it is considered as normal bone. Between -1 and -2.5 standard deviation is defined as mildly reduced bone mineral density compared to the peak bone mass, it is defined as osteopenia. Penia means reduced, that's all it means. So osteopenia. Now at minus 2.5 or below that, then it is defined as osteoporosis. So when you go for a DEXA scan, at the end of it, you will get a report which looks something like this. It's a tricolor inverted. And if you are in the green zone, if your value falls in the green zone, you are okay. You are below minus or above -1 standard deviation, and your bone health is quite good. But if you fall in the yellow, that's where this person is, then you are osteopenic. You are between -1 and -2.5 standard deviation. But unfortunately, if you fall in the red zone, that is means your bone density is below -2.5 and more than 2.5, and you are osteoporotic. So this is how we diagnose confirm osteoporosis by doing a DEXA scan, which is available anywhere now. Every major city or town has this facility to do it, and it is worthwhile doing if you are suspecting that you are osteoporotic, or if you ever had a fragility fracture in the spine or in the limbs. What happens to the muscles in old age? That's also very important, because muscle and bone are intimately connected. They are both responsible for our movement in life. So there is a reduction in the muscle mass that's called sarcopenia. Sarco means flesh. So sarcopenia is what is meant by the meaning of the word is sarcopenia. It is reduction in the bulk of the muscle, or the reduction in the muscle mass. Naturally, there will be a reduction in the muscle strength also. Now, what does it produce? It produces fatigue and weakness. And when your muscles are weak, you have a poor balance, especially when the core muscles are weak, you don't have a proper balance. And this leads to a lack of confidence. On top of that, in addition to all this, you may have some associated movement disorders like Parkinsonism or some neuromuscular conditions, which can aggravate this difficulty in balance. And further aggravation can occur when you have a visual impairment also. You may have a cataract or some retinal disorder affecting your vision. So that also will aggravate the difficulty with balancing yourself and making you prone to injuries and falls. This is what we are worried about. Doesn't matter whether you are osteoporotic, you can still manage without a fall, nothing like that, because that is an injury. Producing a fracture due to a fall is what we are worried about mostly. Now, how do you prevent osteoporosis? It has to start at a young age. Does it mean that it is too late for all of us? No, it's still time. It is never too late to prevent osteoporosis, or to at least control it. What do we do now? So maximize your peak bone mass with a healthy lifestyle. Now this ideally, as I said, starts at a young age. Now you cannot maximize your peak bone mass. At least you can see that the erosion of the peak bone mass is kept at a minimum with your healthy lifestyle. Healthy lifestyle means, among others, good diet. Now, proteins are very essential in old age. Proteins are the building blocks of our body. It is required to build muscles. It is required to build bone. It is required to build every single tissue in our body. We need proteins. And when your intake generally goes down in old age, you need a supplement of protein. And bone matrix is the ground substance of bone on which mineral is like something like concrete. You have to have a cement base in which you put the metal and the steel rods to make it like a concrete. So that cement material is a bone matrix, which is made of proteins, especially collagen fibers, which are the scaffolding, and on which calcium and other minerals are laid down. So you must have a good balanced diet containing enough proteins, calcium, and vitamins, especially vitamin D3. Now, vitamin D is free. It's called the sunshine vitamin. Now is the time to go out and get your dose of vitamin D. Spend 20 minutes in the sun, you have received enough vitamin D for a day. And the WHO recommendation is that elderly people should receive, ideally, especially postmenopausal women, should receive 1000 milligrams of calcium per day. 1000 milligram means not just tablets, it's including your diet also. So if you have a healthy diet, if it includes a lot of milk and milk products or egg and other things, then you have to supplement maybe by 500 milligram tablet is enough. Maintain that you get at least 1 gram of calcium per day and about 750 international units of vitamin D. That's a recommendation from WHO. So if you are able to spend some time in the sun, that is taken care of, then have regular exercises. Now, when you are saying that, oh, I am 70 or 75 or 60, what exercise do I do? There are plenty of exercises which are meant to increase your balance, your muscle strength, and which will help you to prevent any fall or injury. So regular exercises are, as I said, stimulus for bone formations. That is another way of preventing the ill effects of osteoporosis. Avoid smoking if you are a smoker. Alcohol is okay in moderation, but above the limit, if you are an alcoholic, definitely it will increase your chance of aggravation of osteoporosis. So these are the basically about 6 steps I could think of in prevention of osteoporosis. Now, management of osteoporosis, the goals of management are mainly 4. One is to reverse or control that bone loss. Now, whatever has happened, you cannot put it back, but at least you can control the bone loss. Once you know that you have got osteoporosis, you can reverse the process or control it. You can improve your muscle strength and you can improve your balance. You can minimize injuries or falls and see that you're not handicapped. And overall, you can improve the quality of life. So these are the 4 major goals that you have to look at when you're talking about the management of osteoporosis. How do you reverse or control the bone loss and the muscle loss? Again, as we said, a good diet is very important of proteins, calcium, vitamin D, and vegetables and fruits. Vitamin D, again, I am stressing because without that, your calcium is not getting absorbed from the gut and it is not properly utilized also. Whatever calcium is not absorbed will go out as excretion, and so that's of no use. So you must have both calcium and vitamin D3 along with a lot of fruits and vegetables for minerals and vitamins. Exercises are mainly 2. One is, these are exercises to improve balance, which are very simple exercises. Irrespective of your age, you can still do it because they are very simple, straightforward exercises. You need only probably 15 to 20 minutes every day to do those exercises, which will substantially improve your balance. And muscle strengthening exercises, which are very essential because you don't want to lose more muscles. Once you do exercises, muscle strengthening exercises, your muscle bulk will improve, your strength will improve, and your balance will improve. So these are 2 ways to do that. And it has been shown that when you perform resistance exercises 3 times per week, what is resistance exercise? I will show you later. It increases the muscle strength over a period of 12 weeks. Within 12 weeks, you can feel the difference of your strength. So these are very important part of the treatment of osteoporosis. Then, of course, you have got drugs. I will only briefly touch upon this because these are all drugs which have to be taken only under medical supervision. They all have their own complications and contraindications. So you just can't go get these medicines from the shop and start swallowing them. The first group of drugs are called anti-resorptive drugs, which prevent bone resorption or control bone resorption. And the group is called bisphosphonates. You must have heard of alendronate. There are so many preparations available in the market. There can be oral medication like tablets, or it can be injectable form also. Injectable oral tablets are taken every day. The problem with that is they are very, very irritant to the stomach and the lower end of the esophagus. So you have to take them on an empty stomach with a glass of water, after which you are not supposed to lie down for about an hour or so, at least half an hour. So you can sit as I'm sitting now, or you can walk in your garden or in your house, but you cannot lie down because it will produce a lot of irritation to the lower esophagus. Plus, it has got other complications also over a long period of use, but it is definitely, it has benefited a lot of patients suffering from osteoporosis. Then there is another group, that is the recombinant human parathyroid hormone. It's a little ironic here because parathormone we have seen is a potent resorptive agent. It destroys bone in the sense it takes away, it encourages bone resorption and takes away calcium from the bone. But when you give it as an injection, it has just the opposite effect. This is a recombinant human parathyroid. It is a very potent bone stimulator. In the body, it is given as a continuous infusion by the parathyroid because it balances the level of calcium with the infusion. And then it is a resorption of the bone. But when it is given as a daily once injection, then it acts as an anabolic agent producing or increasing bone formation. In fact, of all the drugs that are available or medications that are available for osteoporosis, this is the only agent that encourages bone formation directly. Others are indirectly doing that by reducing bone resorption. But here, not only does it prevent bone resorption, it increases bone formation. So it comes as a pen with needles. So you can do it at home every day. Like I'm sure some people who are diabetic would know how to take injection of insulin at home with the pen. It's just like that. You get a refill after 1 month. You put it in. It's a metered dose. With each click, a particular dose will go into the subcutaneous tissue, and it can be used for a period of up to 2 years. I have used it extensively, and it is a very safe drug. I have not come across any serious side effects. It used to be very expensive, costing about 20,000 rupees because it is imported about some 15 years back. Now there are at least half a dozen or more Indian companies making this drug. So it's available, but not available in the shops because they are trying to reduce the cost by distributing it through the representative. So you have to contact that particular representative and then get the medicine. They will deliver it to your house with a PowerPoint presentation on how to administrate, how to do it. Everything will be taken care of. And when you're finished with the drug, call them 2 days earlier. They will come with the refill also. Another drug is a newer one. This is called the denosumab. It's slightly expensive, which is again, it is a bone resorption inhibition agent. The advantage is that it is a single injection every 6 months. It's again a subcutaneous injection given once in 6 months. I don't have much experience with that. It's comparatively new compared to Terafrac, for example. But anyway, this is one, right? I am not going into more details about the medical or drug management. There are better things to talk in this crowd. Now, I want to stress the importance of activity or exercises, which I have dealt with before. Before you do any serious exercise or think of going to a gym or doing very vigorous exercises, think about your heart. What is the situation there? You may be a diabetic, you may have a hypertension, you may have suffered a heart attack, you may have other diseases like renal problem, liver problem, so many things. So get yourself checked thoroughly, especially with relation to your heart, and make sure that you are fit to do whatever exercises you are planning to do. Now, it's again, as I said, it's a stimulus for bone formation. Activity means impact activities like walking, for example. When you walk briskly, it stimulates the body to produce more bone because you have to support your frame. So it is a very potent stimulant to have an impact exercise. So walking, brisk walking is a good enough exercise. If you can walk, say 30 minutes a day, every day, either in your house or in your garden or in the beach or in a treadmill, but see that you walk slightly more than the normal pace to induce a gentle sweating, for example. That is the correct speed you can go, and see that you don't become breathless. So that activity is a good enough activity. You can do it, as I said, even at home or in a treadmill, doesn't matter. And also you must increase your muscle mass and strength by doing these muscle strengthening exercises. Now, both these will improve your posture and balance. That's the most important, because we are coming again to prevention of falls or fractures. So that is very important. And exercise naturally has cardiovascular benefits. It benefits your heart and your system, provided you are medically fit to do those exercises. And then there is a feel-good factor when you do exercise. There is a tremendous release of endorphin from the brain. When you do exercise, you feel so good after a cold shower, after exercise. That is endorphin release or the feel-good factor. So because of that, do your exercises. Now, this is probably one of the most important slide in my presentation. That is the prevention of falls and injuries, about which I'm going to talk a little bit. Now, one of the very simple aids. Now, all these measures do not need the help of a doctor or a therapist. All this you can do yourself. Use a walking aid. If you feel that your balance is not good, use a walking stick. Don't get sort of ashamed that I have to hold a walking stick. Well, that is required because you want to avoid a fall. Or sometimes that may not be enough. You may have severe problem with your balance. You may need a walking frame to support yourself and walk around. But by all means, do that and walk. Because if you say that I cannot walk, then you are further promoting osteoporosis by that immobility. The second thing is to avoid clutter in the living area. Avoid unnecessary furniture or chairs or stools in your living area, especially where you can trip and fall. Avoid scattering toys of your children or grandchildren on the floor that may make you trip and fall. Avoid loose carpets or slippery mats. Never use a mat which is not anti-slip. Especially now, everybody is using floor tiles, very wash looking smooth floor tiles. You put a mat, a car mat or something over it, you step on it, it will just slide. You can go skating on that. So never use without non-slippery layer in it. And you must have adequate lighting in the room, because many of us, especially in this age group, have some visual impairment, something or other. You may have some mild cataract or may have other retinal problems or corneal problems, which can produce a visual impairment. And that is very important to have a proper lighting, especially during dusk and dawn, when there is a transition from the light to dark and dark to light. The saying is, if possible, live on one level. Sometimes it is easily said than done. But if you have 2 stories, 2 floors, your house, a ground floor and the first floor, try to live on the ground floor if you have a bedroom there. Definitely you are going to have a dining room and kitchen in that floor. So if you have a bedroom also, take that bedroom rather than your old bedroom upstairs, because that will avoid using the staircase, and very many fractures happen due to fall from a staircase, especially if your balance is not good. If you cannot do that, and if you don't have a bedroom downstairs, then you have to go up to the bedroom. Be careful on the stairs. Use the banister, hold on to that, take slow steps, watch each step and see that you don't fall. You have to remember that there is a chance of my falling from this staircase. So that's very important. And anyway, wherever you are moving, move carefully, don't rush. If somebody rings the doorbell, there is no hurry, let him wait. You can go slowly, open the door for him, don't have to run or rush around to get the door open. So these are the simple prevention measures for injuries. I will focus now on the bathroom and toilet, because that is a area where a significant number of falls happen next to the toilet and next to the staircase, probably the bathroom and toilet, because of the wet floor. Most of the bathrooms have a common bath area as well as a toilet area. So when somebody is having a bath, or after somebody has had a bath, the whole area is wet. And an old man or a woman goes to that room again for a toilet or bath, likely to slip and fall. And this common bath and toilet area, especially with the smooth floor tiles, is a sure recipe for fractures. Then absence of grab rails. You must have grab rails, especially around the toilet seat or in the bath area, so that you can avoid a fall. Unfortunately, if you fall, you can hold on to that to get up from the ground. So this has to be given very careful thought about your bathroom and toilet. Make it safe. How do you make a toilet safe? Bathroom safe. Try to enclose the bathing area, whether it's a shower cubicle or not. You can isolate that area which is going to have a wet floor. So the rest of the bathroom, where the toilet is or the wash basin is, you can keep it dry. So there is less chance of somebody falling in that area. And use only rough tiles in the bathroom. Smooth tiles which are used on the wall are not good for the floor. It may look nice, may look shiny, but again, they are dangerous. So use only rough tiles in the bathroom. They also look nice. Now, in the shower area also, if you look at that shower cubicle, the floor is not tiled. It is some kind of a plastic or melamine, which is again very smooth, and with water, it can be slippery and you can fall within the cubicle. So if you have a shower cubicle like that and not lined with this sort of floor tiles, then you must have something like this, an anti-slip bath mat, which can cover that floor area. And if you if you step on that, it's not going to slip. So you can be very sure that you will not fall in that small confined area of a cubicle. And once you have finished your bath, when you step out of that cubicle, have a non-slip mat, which is absorbent for water and which has got a rubber lining below that, which is a non-slip mat. So otherwise, this floor is very smooth. If you step on an ordinary mat, it can slip and make you fall. So always use only non-slip mat. These are very, very what I call significant changes you can bring to your bathroom at a very low cost. And these aids are freely available anywhere in your neighborhood stores or online stores. You can get all these things. So it's not difficult. Now, about your toilet, better to have some grab rails like this. This sort of grab rail, which I found on Amazon, they're very good actually. You can actually pull it up if you don't want it, or push it down like this so that you can hold on to that, which help you get up from the toilet. Or if you are severely disabled or handicapped, then you can have a setup like this. This is also available everywhere, which is quite comfortable because it gives you a sense of confidence when you try to get up from the toilet. So why I'm showing all these things is that we have to reduce the incidence of falls and fractures. That's very important. So these are all much more important than the trucks you use. And these are all things which you can implement in your household and reduce the incidence of fractures. And finally, exercises to improve balance. Now, these are very simple exercises. As I said, I have just put in some links there for the exercises. You can find it in YouTube. I will, if you want, this is being recorded, so you can get that link again. Otherwise, I can send these links by WhatsApp message to the secretary and you can circulate it. There are 2 links for exercises to improve the balance. There are hundreds of them. in YouTube. Two things which I liked, I have mentioned here. Similarly, I got strengthening exercises, which another link I have given. Now, what do you mean by exercises to improve balance are very simple exercise which anybody can do it without any problem of worrying about your health and other things. But strengthening exercises you can do to improve the strength of your muscles. You can use two things for that. Something like this. This is a 1 kilogram weight. You can get this kind of weight, 1 or 2 kilograms, whichever you want. You can use it to exercise against resistance. And if you find out 1 kilogram is too less for me, you can buy a 2 kilogram one. No problem. It's available in all sports stores. Or you can use a stretch band like this. This is very, very good actually. You can get in different strengths. There are depending on your capacity, you can see that. And then you can stretch it and do different exercises. It is all seen in it. You can see all this in that last link I have mentioned. So, because if I have to show all these exercises, it will last this presentation will last another 1 hour. So it's not good enough. So better to go through that link and do the exercise, because that is one thing which will help you a lot. To conclude, I think the main thrust of management of osteoporosis is to minimize its effect on the quality of life. Now, this can be done by prevention of further bone loss and increase your bone loss, or at least stabilize it, the bone density, which you can do by increasing your level of activity or doing exercises and to prevent falls. And naturally, you improve your quality of life. So these are the ways you can minimize the effect of osteoporosis. If you're already suffering from osteoporosis, these are the ways you can minimize its effect on your quality of life and improve the quality of life. This was Ian Fleming in his film, The Live Only Twice. James Bond said, you only live twice, which I think is wrong, because you only live once. So live it well before you ride into your sunset. Thank you very much for your attention. Thanks a lot.
Thank you so much, Dr. Premachandran, for that excellent talk. It was very interesting, very relevant and useful. And especially you gave us a very clear picture of the medical side, as long as also the day-to-day life, what we should do to avoid and what we should do to strengthen the muscles and bones and all that, everything, all the tips. I'm sure everybody will be waiting to ask you questions. Already there are lots of questions in the chat box, which some of which you have already answered in the course of the time.
Yeah, if you can read out the questions, I can answer that.
Yeah, before opening the floor, can I request Usha Nairji, our zonal organizer, to say a few words, and then we can open the floor for questions. Usha ji, would you like to say a few words about the meeting?
Hello. Yeah. Thank you, Dr. Premachandran, for that excellent talk. And it gave a very, very practical side of the whole problem, and removed many misconceptions, I am sure, of many of us. And it was very interesting in the sense that it gave us both about the diets and our daily habits and what we can and what we cannot do. So thank you so much, and thank you, Suvarna, for organizing this interesting talk. I'm sure many of our friends are waiting to ask questions, so I will not say much. So I'll pass it back to you, Bhuneshwari.
Thank you, Shaji. Shall I read it out from the chat box first?
Yeah. Okay. Please. Yeah.
After that, we can have the questions in person. Yeah. A very informative, Kamini says, a very informative talk, sir. Thank you. I have two questions. One is about the sunlight. It's a source of vitamin D. When should we walk under the sun? Meaning morning or evening, which is better?
I prefer, because there's no point in walking in the harsh sun at noon. It's not very good. It's tiresome also. Evening light, say around 4 to 5, depending on the season, just an hour before the sunset, I would say. if you walk in the sun, which is really good, that 20 minutes of sunshine, and you should not cover your body too much. There must be some way the sunshine can act on your skin. So that is good enough. Half an hour of sunlight in the evening or in the morning also, but not in the
Thank you,
hot
sir.
sun.
Thank you, sir. I do walk in the evening, as you say, from maybe 4:45 to 5:45 I walk.
Yeah, very good. Very good. Keep it up.
Thank you.
Kamini's next, before I go to Kamini's next question, Maithili ji has asked, I want to know how far exposure to sunshine can delay bone fragility. Also, how can this be done in hot climate like ours? She's from Delhi, as you know, sir.
Yeah, I would say in the evening, in the hot climate, because in Delhi, for example, the sun sets very late in the night or evening. So it doesn't set in the at 6 o'clock or so. If I remember right, it sets even later. So you can go, once the heat has subsided a little bit, you can go in still the sunshine will be there. You can do that. I think about less than half an hour is more than enough for your requirement. What else was the question? That's all I think.
Maithili ji, that was your answer.
Thank you. Thank you.
Thank you.
Okay. Then Kamini ji has another question. What is osteoarthritis? We were talking about osteoporosis.
Okay.
Now,
Yeah. This is very good question. I'm glad that I could clarify it, because very often people confuse osteoporosis with osteoarthritis. Osteoporosis, we know what it is now. Osteoarthritis is a wear and tear. In simple terms, it is a wear and tear of your joints. Just like a car bearing packing up, or your joint bearings are packing up. That's osteoarthritis. Now, this occurs mainly in the weight-bearing joints like your knees. In Western population, occurs mainly in the hips also. Fortunately, we are ethnicity, we are spared from that. Mainly, we are affecting the knee joints. And it can occur in other joints which are a seat of a previous joint trauma. Now, there what happens is the bearing surface, the smooth surface where the bones come together, which you must have known, that is covered by the articular cartilage. As a part of growing old, the cartilage becomes thin and ultimately gets worn out. So leaving the raw bone to touch the other raw bone, just like a worn out tire without any tread. So that is osteoarthritis. So that degenerative process is a natural process because in body, everything has to decay. That's nature's dictum. Everything has to decay, including your teeth or your brain. So the joint degeneration is part of getting old. It affects your joint cartilage or articular cartilage, and it leads to pain and disability. Whereas it affects the peripheral joints, it affects your spinal joints also. That's why you get backache. It affects the joints of the spine or the neck also. So this is osteoarthritis. That is entirely different. It's a painful condition. It's a degenerative condition. Whereas osteoporosis affects the quality of the bone, not the joint. It has nothing to do with the joint. It affects the quality of the bone, and it's a painless condition. That's the difference between the two.
So in osteoarthritis,
Yeah.
is there any treatment for it, or we'll have to live with that problem?
No. It is 100% treatable now, starting with pain-killing tablets to limitation of activity or regulation of activities. You have now replacement joint replacements. Knee joint can be replaced, hip can be replaced, shoulder can be replaced. So many joints are replaced, and so many people are enjoying the benefit of that.
Okay.
So that is it's a treatable condition, 100% treatable condition.
Thank you, sir. Thank you.
So is there any way of slowing down
Slowing down osteoarthritis, you mean? The wear and tear?
Osteoarthritis, yes.
Yeah, the slowing down is possible. One important thing is to reduce your weight, because more the load on the joint, the more will be the wear. So reduction of joint body weight is one of the most important things in control of or prevention of osteoarthritis. Apart from that, there is very little you can do because it's a natural process, natural decay process that is happening. So apart from reducing your diet and reducing the load on the joint, there is very little that you can do other than treat it.
Thank you.
Then we have Lakshmi Bai. She says, I'm just reading it out. Is it better to have 60,000 IU once a month or a lesser dose regularly? I don't know if you will be knowing. This
Now it's available. See, many of us, because of the change in our lifestyle, including children now, they are suffering from vitamin D deficiency. I have practically stopped looking for vitamin D levels now because every other person I have sent for vitamin D level estimation, they come with a deficiency. See, children, for example, they used to play in the evening sun. Now, at this time, they will all be in the fields playing and they are getting their dose of vitamin D. Now, what are they doing? They're playing with their video games in the living room with their computer or games master or whatever, and they are not getting any dose of vitamin D. Same thing happening with young individuals also. I had a patient who was a young lady who was working in Delhi. She came with severe a combination of osteoporosis and osteomalacia, and she said she has not seen the sun in the last 6 months. That because she was very busy in the office, she used to reach the office before sun rises, and she used to leave the office after the sunset, which is very early in winter. So she never had any, and she was, to add to this thing, she was allergic to milk and milk products. Absolutely no calcium, no vitamin D, nothing. So that is very important. It is there is a study from All India Institute of Medicine in Delhi where they screened children from fairly affluent families going to posh schools in the school bus or their parents' AC cars, and most of them were found to be vitamin D deficient, not because they can't afford any food, because they were not exposed to sunlight. Same thing happens to our Jawans who are fighting in the high altitude in Leh. They don't see any sun during the winter. They have to have fortification with vitamin D. Now, about the 60,000 units dose, it is better in this situation to have that booster dose once in 3 weeks is enough. And if you are very low in vitamin D, I would recommend even once in 2 weeks is enough. But you have to take calcium with that. That's very important.
Lakshmi Bai, is that okay now?
Clear? If I am not cleared your doubt, please tell me.
Yeah, please.
Can I ask?
Yeah.
Can I ask?
Yeah.
I want to know whether that means if I should take a lesser dose, is it?
If you are taking 60,000 units and nothing else, once in 3 weeks is enough.
Once in 3 weeks.
3
And I'm
weeks.
having it once in 4 weeks.
Make it 3 weeks. Once in 3 weeks.
First 2 months I had it every week. And now I'm having it once in 4 weeks.
If you are taking it for the first time, what I would suggest is everybody start with 60,000 unit once a week for the first 2 weeks. Then gradually make it once in 2 weeks. And then after another 2 doses, you make it once in 3 weeks. I think that is good enough for most of
that is. Thank you, doctor. That is the dosage given. But now I'm having it only once a week for the past 2 months. No, once a month, I mean, 60,000.
Yeah,
So
once
that
a
is
week
okay. I
is
can continue
provided you are going for an evening walk or you are taking other diet which are, see, unfortunately.
And I also have calcium. Calcium with
Calcium must
vitamin
have.
D3.
Calcium must have.
Calcium with vitamin D3, that shell cap.
Then that is enough. Then once a month is enough. Because
fish eaters also.
shell cal contains about, if I am right, it's about 500 units of vitamin D.
I have only 250 mg, I think.
Whatever.
500 mg.
Yeah. So then once in 60,000 units once a month is good enough.
Okay.
If you are taking that also.
That is okay. Okay.
Yeah.
Thank you. Thank you.
Even when we have Shelcal 500 with D3, then also we have to take the D3 tablet
I think it's better. I think better to have a booster dose once in 3 weeks. No harm in that. Because we are not going outdoors very much these days.
Yeah.
That's the main problem.
We do have the sun. but we go covered, no, doctor. We don't have, our culture doesn't.
Yeah, that's another thing. See, even our females, they are usually going out in saris and very
Yes.
only below your elbow. That's the only place, or your face, that is all exposed to sun.
Yes, yes.
You are not going in on a beach or in a bikini and lying down there like the Western population. So it's difficult. And the same is true of people who go with this hijab. They have got a lot of problem. I would suggest such people should have 60,000 units every week or at least 10 days. Because they are not getting any sunshine. And unfortunately, there is no dietary source, including milk, which is very rich in vitamin D, except probably certain fish. Even that is not enough. So if you are a vegetarian, then practically your source of vitamin D is only milk or milk products, which is not much of a dose there.
Okay. Now,
Thank you.
Kalyani says non-slip mats is a good idea in the bathroom. It's not a question anyway. So.
Yeah.
Said that, so.
Because yeah, I understand.
Kalyani Raj is written very detailed and informative talk. Thank you, Dr. Premachandran. Kalyani ji, would you like to ask anything now? Kalyani ji is there. Otherwise, I'll go to the next. Okay. Many people have written, informative talk. I'll just go through. Lakshmi Bai, thank you for the informative talk, very meticulously presented. Then Urmila says, excellent talk, doctor. Thank you very much. Then Sudha Aravindan says, very informative talk. Thank you, Dr. Premachandran. Usha Ravi, excellent, interesting talk. Thank you, Dr. Premachandran. Then Padmaja Raghu, excellent and informative. Thanks a lot, doctor. Learned a lot today. Good. Then Lakshmi Bai again asks, can osteo?
That has been answered. That has been answered.
Answered, no? Yeah, that's right.
Yeah.
Then Geeta, thank you very much, doctor. Very informative. Came to know many points to prevent osteoporosis. Kamini ji, thank you, Suvarna. Okay, that is to us. Okay. Padmini ji says, proud of you. Of course, you know Padmini. Usha Ravi, is it a must that we should take vitamin D? That's a question. Usha Ravi says.
Is it a must that we should take vitamin D?
Yeah, that's what you.
Yeah, we have already said that. It is a must, because without vitamin D, even if you take tons of calcium, it's not going to get absorbed from your gut. It's not getting properly utilized also. So vitamin D, apart from, that's one thing I probably forgot to mention, apart from the importance of vitamin D in the calcium absorption and the mineralization process in the bone, vitamin D is very, very important. The functions of vitamin D are getting more and more revealed in the recent times. It is very important for immunity, number one. So this hormone is not yet fully understood. That's what I believe. Because in our student days, we were thinking, okay, vitamin D is required for mineralization of bone. There it ends. But it's not so anymore. It is, and one more thing, it is, if you have a severe vitamin D deficiency, you will develop depression also. One of the causes of depression is severe vitamin D deficiency. So it produces endogenous depression. So everything is important in vitamin D, not only for mineralization, for your immunity, for depression, and it also causes muscle weakness. So that's very important. Vitamin D you should take.
Now, anybody who would like to?
No, but if you are getting sufficient sunlight, is it still required to take supplements?
If you are getting sufficient sunlight, is it still required to take vitamin D supplement?
Yes.
That's a question.
Yes.
Yeah.
Yes.
The answer to that is you can check your vitamin D levels, and if it is not adequate, then it means you should take supplements. Because as I said, your exposure when you go out in the sun is very limited. The area that you expose to the sun is very limited. That's a problem.
Thank you.
Protein intake and for vegetarians.
Yeah, I already stressed that protein is a building block which is needed for every single tissue in the body. And protein intake, supplementary protein intake is recommended, especially for vegetarians, because they have a very low levels of protein intake. And even for non-vegetarians who cannot take much food, because generally you tend to eat less during your old age. So such people, it's better to have a protein supplement which are available in the market. Any form of protein supplement is available. You should take that.
There are not much in the chat box now. The questions somebody has written now. Something else has been written in the chat box just now.
Yeah.
One doctor told me to take vitamin D for 8 weeks. Should I take more? That's it's basically on vitamin D only.
You should not stop after 8 weeks. You can reduce the dose probably, like I said, if you are taking Shelcal also, you take 60,000 vitamin D once in 4 weeks, or otherwise you take once in 3 weeks. You should continue that. Unless you have other source of vitamin D, whatever it is.
Sarla Chechi also says, excellent and highly informative talk. Thank you.
Thank you.
And now, there may be many others who will be having doubts also or want to talk. Shall we close this presentation thing so that we can see all, everybody can see?
I just want to know if the vitamin D level is normal.
Yeah.
Should we take medicine?
Should we take vitamin D supplement?
Yeah, supplement.
Yeah. If your vitamin D is normal, because you are taking supplements, that means you should continue taking that supplement.
No, I'm not taking supplement. At the moment when I test, it's normal. It says it's normal.
Normal. That means you must have some other source of vitamin. Maybe you're walking in the evening sun.
Every day there is a box.
Oh, then that's fine. Then that's fine. Absolutely. No problem. If you are,
so you don't have, sorry, in that case, you don't have to take vitamin D, isn't it?
so if your vitamin D levels are normal, within normal limits, there is no need to take additional supplements. That is true. But I would still say that one reading is not enough. So that time it may be normal, but maybe after a week it would not be normal. So no harm in taking a 60,000 tablet or capsule once a month or once in 3 weeks. No harm is done.
So there is no harm. Huh? Okay. Thank you.
Thank you.
Thank you, doctor.
Dr. Sir, can we stop the sharing the screen so that we can see everybody and
yeah,
we
okay.
can all talk? Many of us will be having questions. Please go on.
Damini.
I can see a question here. Is there any?
Is there any food to increase our vitamin D?
Not much. See, you can get maximum level of D from probably certain kinds of fish, like salmon or the small oily fish. But other than that, or meat, but vegetable level sources are much less. Unless, say, previously you used to get this food fortified with vitamin D. Unless now, I don't think it is done. But if it is done, then it's okay. Otherwise, not many food will contain enough vitamin D to sustain us, especially in vegetable or vegetarian side.
Sir, I asked that question, should I take more? Doctor told me to take a vitamin D 8 weeks. Should I take more? I asked that question.
Yeah.
Gary. Should I take more of the same vitamin? That is 1000.
How much were you taking?
I take only once in a week. Only 8 weeks I took.
Yeah,
Now I
that
stopped it.
you can reduce the frequency now to once in 3 weeks.
The same medicine.
Yeah, 60,000 units once in
Okay.
3 weeks. Yeah.
Okay, thank you. I am having this knee problem very much, doctor. That's why I asked
What?
again.
You are having what?
I am having this knee problem very much. That's
Yeah,
why.
that is osteoarthritis probably. Yeah.
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 Okay. Okay, I'll take. Okay,
Okay.
thank you, doctor.
Got disconnected. So if anybody else wants to ask questions, I can see some of you are unmuted. Is there anybody to ask question?
Can't hear anything. I can't hear anything.
Is there anybody who wants to ask questions? Can you hear me?
I have to ask something. I want to. Prakashni here.
Yeah, please ask. Please go ahead.
I'm just asking whether any exercise is suggested for this.
Sorry, I didn't get it. Say that again.
Any exercises?
Exercises. That's what I said. I've kept the links on the presentation. So you can see this video on YouTube. So you will know how to do it. Describe also. You can do along with them. Play the video and do along with them, or learn them and do it. It is available in YouTube, which are links which I have already shown there. If you want, I can send the links as a message. Shall I send it to Mrs. Bhuvaneshwari? Is it okay?
Yeah, I think you can share with Bhuvaneshwari.
Yeah, you can share it with your members, if you want.
Yeah, she can put it in the group.
I will do that. I will do that. Yeah.
Thank you.
Thank you, doctor. Thank you, doctor.
Thank you.
It's very much informative.
So if we have had talks, then now can we move on to the formal vote of thanks? If there are no other questions.
I think some people are still unmuted. You can just ask them whether they want to ask it.
Okay. If are there anybody else who want to ask anything? Amriti, you want to say something? I think Ushaji, no. Then Patmaja, you have something? ആർക്കെങ്കിലും പറയാ എന്തെങ്കിലും സംസാരിക്കാനുണ്ടോ?
Hello, Guna. I put in chat box.
Will
you read for me?
Sorry.
Okay, chat box related now. Unfortunately, I had left. In between, I had a problem with my network. So it is not there in the chat box now. On the Parnyolu, you can call. Parnyolu.
I asked one question which has been given answered by the doctor, but I could not listen it, unfortunately. So can you repeat the answer that should I take shell call daily or alternate days? That I could not hear the answer.
Shell cal 500 you can take daily, no problem, because it contains only 500 milligrams of elemental calcium and vitamin D. So you can take every day shell cal 500. That's okay, provided your diet is otherwise balanced or normal. If you take a lot of milk products, yogurt, milk and other things, then it's okay. 500 milligram is enough. Shell cal 500.
Okay, thank you.
The calcium is more, is it some sort of any harm will be there or?
There is a lot of controversy about it. Normally, that's why WHO said take average about 1,000 milligrams of calcium per day. Now, what happens? There are people who suggest even 1,500 grams of calcium for elderly people if they are osteoporotic. But beyond that, there is the theory that it will affect your other systems. It may produce renal stones. It may produce cardiac problems and all that. But these are all not very well proven things. It's all because normally there is a regulatory mechanism for absorption of calcium. Body will, the parathyroid and kidney, everything, they will manage to see that the calcium level is maintained, and beyond that there is no need for absorption of calcium. So there is a blockade there. So I don't think that will cause any from the therapeutic dose you will get any toxic effects of calcium. I don't think, especially if you take something less than 1,000 milligrams per day, nothing is going to happen to you.
Okay. Thank you.
Hello, doctor.
Okay.
Hello.
Yeah.
I have one more question, doctor. I am taking daily one tablet containing glucosamine 1,500 mg and chondroitin 1,200 mg, and also one vitamin and mineral tablet. Is it good for me, or should I stop it, or should I continue it?
This chondroitin sulfate, glucosamine, these are all medications which are given for osteoarthritis, not for osteoporosis. And the theory is that they are the basic building material of articular cartilage. That's the cartilage in the joint. So when you have an articular cartilage problem, these things that you ingest will go into the joint and repair the cartilage, which is an evidence which lacks a lot of evidence. And to be fair, I have never in my lifetime prescribed any of these things. These are not scientifically proven that it will improve your not for osteoporosis. It will not improve your osteoarthritis. There is no hard evidence to suggest that they are beneficial in osteoarthritis. It is a drug which is available across the counter in USA, and it's a multi-billion-dollar business. So if you want to take it, it's entirely up to you. But no harm will come from that. But I don't, frankly speaking, I don't prescribe that medication because there is no evidence that I can see which mentions, which approves its beneficial effects which they claim it has.
Okay. Thank you, doctors.
Any more questions or anything somebody wants to ask?
Can I ask one question? So
Yeah.
what is is there any other supplement that can supplement cartilage growth?
No. See, this is what I said.
Okay,
Body general rule, if nature has ruled that things in your body has to decay. So cartilage is undergoing that natural degradation. Nothing is going to stop that. Unless you can reduce it, the amount of degradation or the rate at which it wears, you can reduce by reducing the load on the joint, by reducing your weight. Other than that, that's something which you cannot stop.
Okay.
It is non-reversible.
Thank you, doctor.
Okay. Now, what next? Can we move on to the formal vote of thanks by Amni Shashikala Tampan? Is it okay? Usha? Is
Yes,
it okay?
I think you can move on.
Move on, no? Okay. Shashikala?
Thank you, Vineshwari. Am I audible?
Yeah.
You are audible.
Yeah.
Aging is just another word for living.
Sorry?
Aging is just another word for living.
Yeah.
Getting old is like climbing a hill. You get a little breathless,
Yeah.
but the view is much better.
Oh, yes.
When we feel that first ache in the joint and that pain in the neck and a fracture, it triggers anxiety and fear. Do we need to slow down? We ask ourselves. Then we compare notes with friends who are traveling in the same boat. Dr. Premachandran, your excellent presentation has made us better informed about the realities and how to face them. Some points, the takeaway. The focus was on the control and management of osteoporosis.
Yeah.
That silent thief who rocks your bones. 80% of osteoporotic are women. And so, yes, women are at greater risk.
Yeah.
Bone resorption, more than bone formation, leads to osteoporosis. Hormonal changes also. Prevention and management of osteoporosis. Starting at a young age, maximize your peak bone mass with healthy lifestyle, a well-balanced diet to get your proteins, calcium, and other minerals, vitamin D, that sunshine vitamin, regular exercise, a moderate program of strengthening exercises to minimize the effect of osteoporosis, to improve balance, stimulation of bones, the feel-good factor. Move carefully. This straight from the doctor.
Thank you.
Don't rush.
Yeah.
Reduce incidence of fall, injuries. The discussion that followed was immensely rewarding experience for all those who had doubts and very good participation. Thank you, sir.
Thank you.
Choose holistic wellness solutions that can provide nourishment for the bone and the soul. Dr. Premachandran, thank you so much for accepting our invite and being the guest speaker today. It has been a privilege to listen to you. Thank you, sir.
Thank you very much. Thank you.
Kalyani Premachandran is that bright spot in our executive committee. Well-read, a source of inspiration.
Okay, good.
Suvarna thanks Kalyani Raj, AIWCA member in charge, and Usha Nair, our zonal organizer, and all the members who I think really participated in this discussion. All the members of all the branches in Kerala and outside Kerala joining us today. Thank you.
Thank you.
Over to you, Bhuvneshwari.
I think I should thank Shashikala for so, nicely, meticulously noting down and summarizing the whole, I think that was really nice, summarizing it. Thank you so much, Amni, for the good, excellent Thanksgiving, vote of thanks. And now that's it. We are at the end of our program today. Is there anything else anybody would like to say or something, or can we close the meeting today? Okay, Usha? Usha ji, can we?
Yeah, I think we can close the session. Okay. Yes, it was a very useful session and a lot of people have joined. So the YouTube link is available. I have already shared in the groups. And those who missed any portion of this can go back. So thank you so much. Thank you, Dr. Premachandran, and thank you, Suvarna.
Thank you. Welcome.
And thank you all the other participants. So with your permission, let me end the session now.
Thank you, Dr. Premachandran. Thank you so much. That was excellent. I didn't want to, use up too much of time talking about it. It was, thank you so much. And Kalyani, thank you so much for helping out. And
Thanks a lot again. Thank you.
Thank you so much.
Thank you.